Okay, let's talk about flexibility. This is something that's often overlooked in training programs. It is a health-related component, and it's important for you to understand how it fits in to a training program and why you should do it. So what we can change is the length of the muscle, and that's really what we're trying to get to when we talk about static or dynamic or PNF stretching or even ballistic stretching. So we're trying to lengthen the muscle, stretch out that connective tissue that is the scaffolding of the muscle itself. And then you have joint structure. That's genetic. It's unchangeable. We can't do anything about it. But it's what fixes the joint into position and prevents it from going through too great of a range of motion. And it is, you have a joint capsule with ligaments that actually hold that joint together. So muscle lengthening, we're talking about the collagen and elastin. The collagen are the white fibers, if we looked at them underneath the microscope, that actually is the scaffolding for the connective tissue, and the elastin allows it to be stretched out and come back to its normal shape. Think of it like elastin in a waistband. These would be the white fibers. The collagen would be the white fibers. Elastin would be the yellow fibers if we were looking in a microscope. You have the sarcolemma or the myelema. We're talking about the same thing. It's the same terminology. And that's that connective tissue that holds all the fibers or holds the muscle together. And if you wanted to look at each one of these, like the endomysium holding the myofibrils together, perimysium holding the muscle fibers together, and epimysium is going to surround the muscle itself. And here's a diagram of what I just talked about. You've got muscle fibers at the lowest level surrounded by connective tissue bundled together, and then there's your endomysium around it. And so you can see the anatomy. I won't read through each one of these, but what I just talked about on muscle lengthening is illustrated, and it kind of shows you how the muscle's constructed. The reason that's important to understand is because all of this connective tissue that binds the muscle fibers together, or the muscle fibrils make up the muscle fiber, and then the muscle fibers will make up the muscles once you bundle them together, is because we've got to lengthen that connective tissue when we're doing our stretching. So that's how it fits in to the subject of flexibility, and that's why it's important to understand. So let's look at the actual joint structure. Again, it's genetic, it's unchangeable. So we have a tendinous attachment out here on the outside. You can see that on the illustration, but then you get to the ligaments on the inside. So you'll have a joint capsule. Let's just pretend that this one is the femur, this one is the tibia. You're going to have the articular cartilage at the end of the bones. Think of that like the Teflon of bones. So it's real slick and it doesn't allow a lot of friction. Then inside the synovial cavity, you'll have synovial fluid. Think of that as the lubricant of the joint. That's the reason you also want to stay hydrated, so your body produces enough synovial fluid. But ligaments are going to hold bone to bone, and your tendons are going to attach muscle to bone, so don't get those two confused. And this illustrates the joint capsule, and then you may have, or you will have, different ligaments that attach bone to bone, so like the ACL, PCL, all these different ligaments that hold the knee together. But your joint structure is genetic, it's unchangeable. And you have different types of joints. So you have plane joints, like we see between vertebrae. You have hinge joints, like you would see on an elbow or a knee. You have ball and socket, like you would see for the shoulder girdle or for the hip bone. And so you have saddle joints like you see in the wrist, and you have pivot joints that you're going to see between the radius and ulna, and then you have ellipsoid joints that you're going to see here at between the base of the skull and the vertebrae. So you got different types of joints that have different ligaments that hold them together, different joint structures, and they have different functions. I will say the greater the range of motion, the more likely that joint could be injured because it doesn't have as much structure to hold it together. Whereas like a hinge joint is extremely strong. The reason you see knee injuries occur, even though it's a hinge joint, is just because you have all the weight on top of it. But a hinge joint is probably one of the strongest one of the group. So types of stretching, like I mentioned before, you have static, which is just holding a fixed position at the end of the range of the motion. Dynamic stretching would be where you go through a range of motion, like a kick can be used as a form of dynamic stretching. Ballistic would be more explosive, where you bounce inside the stretch. It's a little bit more dangerous. And then you have proprioceptive neuromuscular facilitation, PNF stretching. These both activate different proprioceptors. The ballistic stretching, you do not want it to activate the muscle spindles, but sometimes that happens. And we'll talk about this in the next few slides. And then you have proprioceptive neuromuscular facilitation. You want this one to activate a proprioceptor, and that's going to activate the Golgi tendon organ, which is kind of like a safety switch inside your tendons. So if there's too much stretching of the tendon so that you don't tear it away from where it's attached, it'll tell the muscle to relax. And that's what's happening in PNF stretching. The person stretches, maybe the person is pushing. You have an assistant that pushes your leg towards your head. You keep the leg straight. That's going to stretch out the hamstring. And then once you get to a position where you can't go past it, you push back against the person pushing the leg, and that'll stretch the tendon and activate the Golgi tendon. And you do that for about 10 seconds, and then that should allow the muscles to lengthen. You release the contraction. They should be able to push your leg a little further than before. But the Golgi tendon organ is found in tendons, and it tells the muscle to relax, and that's with PNF stretching. Then you have muscle spindles. They're found within the muscle. They actually tell the muscle to contract. And if you're at the bottom of your stretch and they tell the muscle to contract, you can tear the muscle. You can rupture the muscle. And that's why it can be dangerous, especially in PNF stretching. Sometimes the muscle spindles are activated. So stretching before explosive events can actually impair your performance because they activate the Golgi tendon organ. So if you're going to do something like sprinting or kicking really hard, you'll want to make sure you do a warm-up. And then after the warm-up, you can do your main event, and your explosiveness won't be impaired. But if you stretch, like a lot of static stretching, right before you do an event that's explosive, you can actually slow yourself down. You can inhibit your performance. Injury prevention, and I've mentioned this in other slides, there is no difference, no short-term difference. Like if, let's say I have 3 groups. One group does a warm-up before they work out. One group does nothing, they just start working out. And another group stretches, static stretching, before they work out. There's no difference between the group that went in cold, that did nothing, and the group that actually stretched. But there is a huge difference, short-term difference, for those that warm up in injury prevention. Mainly because you've got blood flow to it, to the muscle, and so you're less likely to tear a muscle because it's warmed up. But stretching before a workout can actually impair your workout if you're doing something explosive. You want to do a warm-up first, then your main event, and then cool down with stretching. That's the best time because the muscles are warmed up and you're less likely to tear a muscle even during the stretching. Now for long term, yes, there is a huge change in injury throughout the lifetime. That means somebody that's more flexible, that goes through a greater range of motion than they're accustomed to, is less likely to get injured. So if you twist the wrong way and you're somebody that's super flexible, you're less likely to get injured than somebody that has really tight muscles and does that same range of motion. But we're talking about apples and oranges at that point. Short term, you want to warm up. And over the lifetime, the person that is more flexible will be less likely to get injured. Stretching to prevent injury, we talked about it. Stretching prior to exercise, no change. But you can do dynamic stretching as a warm-up. But definitely don't do any ballistic stretching as a warm-up because you're more likely to tear a muscle. cool down, that's the best time to do your static stretching because the muscles are warm, you have blood supply there, and the muscles are hydrated and less likely to activate the Golgi tendon organs, and are not less likely to activate the muscle spindles, and you're less likely to tear a muscle. So sprains versus strains. We talked a little bit about this, I think, in the muscle strength lecture. But spraining a joint means you're doing damage to the ligaments. But you strain a muscle, so you rupture a muscle or you rupture a tendon. So make sure you know the difference between those types of injuries. A sprain is ligaments, and that's bone to bone, right? They hold the bones together. And then you strain a muscle or a tendon, and a tendon is an attachment that attaches the muscle to the bone. And we've talked about these grades of injuries before, but they're relevant, especially when we talk about flexibility. And the grade 3 is the worst. And I showed you an example of Chuck Liddell pulling his hamstring being grade 3. Flexibility and age. As we age, we lose strength and elasticity. So just like the elastic in your waistband no longer recoils back to its normal shape, same thing happens to the elastic or elastin in our muscles over time. So the number and size of muscle fibers also decreases, water content, so they're not as hydrated as we age. So we have a lot of age-related problems when it comes to flexibility. Muscles start to shorten, especially if they're not stretched out. You can change that if you stretch out and do yoga or flexibility exercises throughout the lifetime. You can definitely slow this progression or this change. Reducing circulation has an impact. Prone to muscle strains and tears, mainly because of all these above that I just listed. And you also have genetic diseases like arthritis that can cause problems with flexibility. And it doesn't just have to be the elderly that will suffer from that. But these are all age-related changes in flexibility that we see. Electrolytes and cramps. So electrolytes can actually cause the muscle to cramp up right when you're going through a range of motion. That can injure you, so you want to stay hydrated. And it will reduce the chance of you cramping up. When I say staying hydrated, it doesn't mean just drinking straight water. You want to make sure you're replacing those electrolytes that you may be losing, because you can drink straight water and not get your electrolytes replaced, and then you are still more likely to cramp, and then which can result in muscle strains during activity. So I know that says ACGM, so really what we should say here is American College of Sports Medicine. That is wrong. Let me change that. American College of Sports Medicine. So it should be ACSM recommendations. So flexibility activities, how often should you do them? So you should have 2 to 3 days per week at least, and then hold the stretch for at least 10 to 30 seconds, and repeat these activities 2 to 4 times to get the maximum amount of change. This can be due to static stretching, dynamic stretching, ballistic, PNF. All of these can be used. Ballistic is the more dangerous of the 4. So you would definitely want to have a good warm-up before you do any type of ballistic stretching. So, and it's most effective when the muscle's warm, just like I was saying earlier. You should do this at the end, and then I'll follow the American College of Sports Medicine recommendations. So I'll try to keep this video short, and I will see you in the next chapter.